Why do I remove my sutures after every surgery, even if I could use absorbable stitches? Well, the good thing about absorbable stitches is the skin dissolves them, so you don't need to come back and have them removed. The downside of it is it's A, something that takes a couple of weeks, and B, it creates an inflammatory reaction, so the tissue in the skin is actually working hard to dissolve this suture, and this can actually aggravate scar tissue formation. So many years ago, I was using these kind of stitches for lip lifts, but in a very short period of time I understood that there's actually more irritation in the scar because it has to work harder than when I remove them. And that's the reason I'm not a big fan of absorbable sutures in lip lifts. I use some of the absorbable stitches in facelift surgery, and in particular on the tragus behind the ear and also on the earlobe, to secure that patients, even when they're pulling on the earlobes after surgery, which nobody ever does, but suddenly something does happen. So these are the things where we use absorbable sutures because they can stay for weeks, and it does take a couple of weeks, at least 2 to 4 weeks, for these stitches to dissolve. Not a good idea for the lip lift though.